Without further ado, let me hand over the time to Tristan, who will be presenting for his team. Tristan, please.
A very good morning to our distinguished judges and our audience. We are Osteohex, and we're bringing back the retro arcade to the fitness corner. So the problem that we're looking at today is knee osteoarthritis, and our challenge is to augment the current managed modalities used for stage 1 to 3 knee osteoarthritis in the elderly aged 65 and above. And our solution is a platform to enhance strength coaching and physiotherapy with decentralization, gamification, and machine learning. To tackle our problem statement, we started by doing interviews of patients with knee OA, and we discovered that transferring and mobility were actually two of the activities of daily living that they struggled with. And we realized that this was due to not just the general wear and tear of the articular cartilage, but also muscular atrophy and weakness. So we did some research and we discovered that only 40% of seniors exercise at least 3 times a week. And strength training is one of the less common exercises that they do. So we sought to find out why, and we shortlisted 3 reasons. And the first is the issue of accessibility. For elderly patients with knee OA, they already have mobility issues, and traveling to centralized locations like physiotherapy clinics and hospitals or gyms isn't the easiest thing for them to do. And many of them won't fork out the money to pay for a Grab or a cab. And the second reason was that they are unsure of what kind of exercises to perform, having a lack of gym exposure. And finally, a general lack of motivation. So we realized that the need in the market was really a way to provide decentralized and appealing strength training to strengthen the muscles surrounding the knee joint of the elderly OA patients. And so our platform addresses this need by integrating 3 components. The first is a smart brace, which is used for the monitoring of exercise movements. The second is retro games for motivational appeal. And the third is machine learning for personalized exercise and gamification. So our brace design incorporates 6 electromyography sensors, which are placed on the muscle surrounding the knee joint, 2 inertial measurement units, as well as a dynamometer. And the whole intention of this design is really to measure parameters such as the maximum force exerted during contraction, range of motion, as well as the relative involvement of the various muscle groups to detect imbalances. And so the equipment that we're intending to use is actually equipment that can be found in fitness corners all over Singapore, such as the leg press machine, the stationary bike, and the elliptical trainer. However, we foresee that patient motivation and compliance is an issue. And to tackle this, we're actually thinking of using games such as Pac-Man and Pong and Space Invaders, which the elderly patients probably used to play when they were younger, and so they should have some sort of familiarity with these games. And the idea is that physical movements measured by the brace would translate into game actions. So take, for example, the game of Pong, and our prototyped brace, which is on the right leg, actually moves, and this translates into paddle movement, as you can see here. So to amplify our motivational aspect, we're actually thinking of using these 2 other factors, such as the social aspect. And we realized that we could make our games multiplayer, such that they can be played either competitively or collaboratively. And we're thinking of tapping on the spirit of community as well as some friendly competition to kind of introduce some form of peer pressure to induce the elderly to exercise with their peers. And the second is rewards, and these could include things like discounts off coffee or even vouchers at NTUC, which would incentivize our elderly patients to exercise at their fitness corners. And our value proposition is really that we can provide decentralized strength coaching and physiotherapy such that our patients don't need to travel all the way to, let's say, SGH if they live in Pasir Ris or Punggol. And we're also going to provide personalized exercise regimes, which can be developed using machine learning, using the EMG data, as well as gamification. And our platform has already been endorsed by Associate Professor Lau Tang Ching, Senior Consultant at the NUHS, as well as Ms. Dilaga Govindasamy, Head Physiotherapist at Vira's Physiotherapy. Associate Professor Lau has also said that he will be willing to work with us to develop this idea further. And so we intend to develop our platform as both a consumer product as well as a medical device. On the consumer side, we're looking at developing a health and wellness product similar to the Apple, Garmin, Fitbit, and these will be distributed via a D2C position to general consumers such as caregivers and patients. For the medical device, we're looking at developing it as a health management tool for monitoring and even outpatient forms of physiotherapy, and this will be distributed and marketed via B2B position through doctors and physiotherapy clinics. And the reason we're doing this is that in the OA market, only 5 in 10 elderly knee OA patients consult a doctor, which means that if we are to have substantial and meaningful impact in tackling the management of this chronic condition in the community setting, we need to reach patients both as consumers and through healthcare professionals. And so our project roadmap really starts from this quarter of this year, where we define and plan our scope, and will lead up to consumer commercialization in the first quarter of 2023 and medical device commercialization in the second quarter of 2025. In between then, we're looking at several rounds of prototyping and testing, as well as obtaining regulatory approval from the Health Sciences Authority. And so key activities that we will start with involve engaging with Singapore Biodesign and Jumpstart, such as attending the Digital Health Bootcamp, which will be happening in September, organized by Jumpstart, and also tapping into their network to identify key opinion leaders, which would include clinicians and physiotherapists, of which we are intending to consult at least 10. And the goal for this stage is really to define the requirements that will be used for building our prototype, and as well as planning the whole project out. The next stage, which will be more of a discovery stage to have a proof of concept, will involve us integrating into the startup ecosystem even more by applying for grants from Startup SG, such as the Startup SG Founder Grant, Intuitive, as well as attending accelerator programs such as that provided by MedTech Actuator. In terms of developing our prototype, we're looking at hardware development of retrofitting the brace with off-the-shelf components, and software development through the coming up of games and integrating them with our hardware. And the goal for this is really to conduct a prospective cohort study of 50 participants. The funds required will be 100,000 Singapore dollars. And at the end of this stage, we envision that our product would really reach a technology readiness level of 5. And so this graph shows the expected results that we want to obtain, and we want to test the hypothesis that greater compliance to the use of our product, given a usage model which will be informed by physiotherapists and clinicians, actually increases strength. And we aim to establish the baseline values for each of these cohorts as well. Looking at our business model, our cost structure includes costs from R&D and manufacturing, clinical trial, marketing, certification from ISO and regulatory approval, as well as manpower. Our revenue streams will include revenue from the sales of the knee brace, as well as subscription to our mobile app platform. Customer segments that we're looking to target include OA patients, their caregivers, physiotherapists, as well as clinicians. And the caregivers, particularly the loved ones of our patients, are the customers that we're looking at targeting particularly. And this is because the issue of inaccessibility doesn't just affect patients, but caregivers as well. Many caregivers accompany their loved ones to their physiotherapy appointments, such as they would to their doctor's appointments, and this involves a cost for them in terms of time and money. And if they don't, the safety of their loved ones during the commute to these centralized locations may be a cause of emotional stress and concern. And really, they do have a vested interest in the health and the well-being of our patients, so we're looking at marketing our product, our platform, to them in a greater way. Entities that we're looking at partnering with include medtech and startup development organizations such as Singapore Biodesign, Jumpstart, MedTech Actuator, as well as SG Innovate, the Endpoint One Institute for Health for their expertise in digital health and machine learning, and finally, the NUHS as our clinical partner, with Professor Lau as our principal investigator. So as for the pricing of our product, we're looking at pricing our consumer brace at $79.99, and the medical device at $159.99. For our app, our consumer version will involve a freemium subscription model, where the basic version is free, and the premium version will cost $10 per month. The app, which will be provided to healthcare providers, will cost $25 per patient per month. And so really, we're asking all our potential partners for funding, for key opinion leader and clinician engagement, for their relevant expertise, as well as tapping into their networks. And the target that we're looking to raise is $100,000 to cover our proof of concept testing, such that we can go further in our process. So help us to help our seniors, and in doing so, we will help you, the caregivers. And brace yourselves, because the future of OA management is going to be fun. Thank you.
Thank you, Tristan, and thank you, team. We'll now be inviting the rest of your team to stage and hand over the time to our judges for Q&A.
Okay, I'll take this question. Thanks, Dr. Lee, for this question. Our age range for our target audience, well, based on our problem statement, it's 65 and above. But in terms of our aging population and knee OA management, we're really looking at not just the elderly, but also our pre-elderly. And this is because articular cartilage wear and tear, even muscular atrophy, actually happens before people are 65. And as for the games they kind of play, well, Pong was released in the arcade in 1972. So if we look at somebody who is 65 now, they would be born in 1956, which means they will be approximately 16 years old when Pong came out. And we believe that that is a reasonable game that they would play. Yeah.
Hi, sorry, Suchi, I don't think we can hear you. No, it's okay. I can show the next question first. This is by Dr. Agata. So Dr. Agata asks, what external equipment will you be required to perform exercises? Are you planning to personalize the position of the sensors to specific medical case and specific exercises? Does your brace allow it? Is there such a function? And how often the sensors need to be maintained?
Right. Thank you for the question. So the external equipment that we're thinking of using is actually fitness corner equipment. And there's really a wide range of exercises that they can do, which can train the different muscle groups surrounding the knee joint. So, I mean, this involves leg press, which trains the quadriceps muscles. There's even stuff for the hips, such as the hip twister and the swing walker. And we're really planning to personalize. As for the position of the sensors, we are planning to personalize it more for the medical device in terms of what's recommended by the physiotherapists and clinicians. But for the consumer product, we're looking at just a general kind of setup, very single setup. But the medical device will involve some sort of personalization. As for the specific exercises, yes, our brace can do it, and this would be really through both platforms actually for the personalized exercise. We can use machine learning or artificial intelligence to recommend exercises based on the EMG data, which kind of measures the relative involvement of the different muscle groups. Say, for example, if there's an imbalance in that my quadriceps are stronger than my hamstrings, then I need to train my hamstrings more, and that can be detected via machine learning. And as for how often the sensors need to be maintained, well, for the EMG, we're actually looking at every time a person exercises, perhaps replacing electrodes. We could come up with a more permanent and non-replaceable solution in the future. As for the movement sensors, we're going to use inertial measurement units, which don't drift as much as accelerometers. So these shouldn't need to be replaced.
Yep. Thank you for your response. Next up, we have a question by Mr. Joshua. Let me just show you on stage. What is the difference between consumer brace versus the medical brace, as well as your freemium models?
Right. So our consumer brace is really intended as more of a health and wellness product, and the sensors that they use will be perhaps cheaper and more common. The medical brace really involves clinical grade sensors such as the kind of electrodes that are used, the accelerometers, and this is really for applying for regulatory approval to get our brace certified by ISO, whether it's through 13485, 14971, and so on and so forth. So for our freemium, our app models, the freemium models, basically the basic one will just be a certain amount, a certain number of games, a limited number, and perhaps a limited number of rewards. But our premium model will really include more games, more features, more rewards, and yeah.
Just to add on to that, the app also, when we're looking at using as a medical device, will include the physiotherapist or the doctors in the process for prescribing exercises through the machine learning, because if you have a physiotherapist or a doctor, then they can look through the exercises that the machine learning is recommending and kind of give better suggestions or tweak them, or so they'll be included in the process of prescribing exercises and looking at what the app is doing. So they'll have their own platform on the app also.
Okay, thank you for your response. Hope that answers your question. Next up, we have one by Dr. Mary. Do we know what is the efficacy rate of current knee OA rehab apps? Will your gamification component help to improve this take-up and efficacy?
Thank you. I'll take that question. Well, currently, as for apps in the market, we mainly found more general fitness wellness apps such as Strava, even things like Lumi Health, which is one of our competitors. And the problem with those is that they don't specifically target knee osteoarthritis, but they're more for general health. And something like the Apple Watch, which is used in Lumi Health, doesn't measure the strength around the knee. So it really won't help in terms of strength improvements. As for the gamification component, well, we're looking at the success of Pokemon Go and how it was really, there's a study performed by SUTD on how Pokemon Go in its latter years was really taken up by the elderly, and they were into it. They did better than all the young ones. So we think that gamification can really help.
Yeah, okay, thank you. Adding on to the aspect on implementation, so on this, are there any standardized or rather standard exercises that an OA patient should do? And what happens when they do not have access to equipments in the fitness corner you mentioned?
Right. So I believe there are standard exercises that OA patients should do in terms of strengthening the muscles in a very general way, such as perhaps their quadriceps, say for example. And these would include, like the leg press, or even just like getting up from sitting to standing, those kinds of things. And things like getting up from sitting to standing, they perhaps don't need to go into fitness corners to do these. They can do this at home. So perhaps even if they don't have access to a fitness corner, we can leverage common equipment that's found in homes or even HDB blocks. Say, for example, the staircase. And we can get them to use these forms of features, in HDB blocks or wherever, to perform their exercises.
Just
Okay.
to add on to that again, we also wanted to implement a feature of the app where when it is prescribing exercises, it'll recommend ways to do them. So like doing leg presses against against the wall or something. I'm not sure. Or the way that you walk up and down the stairs and stuff. So that'll be included when you're recommending exercises, so that there are alternatives on how to do them if you don't have access to a fitness court or you don't want to go downstairs. Yeah.
Okay, thank you. So now shifting a bit to the business model. So I think Dr. Mary is asking for more explanation on the, whether you have any estimates on the product fee and willingness to pay from both consumers and medical products. Yeah.
Sure. I think as we mentioned just now, there's two different pricing categories, one for our consumer and one for our medical. And in terms of the willingness to pay, so if we compare our product to, let's say, standard physiotherapy, private ones can go up to $100 per hour, public ones probably cheaper, and it's a recurring cost, really. So most of this cost, if it's especially the part that's paid by the patient rather than the public funding in terms of subsidies and whatnot, is actually often borne by caregivers. And they pay, and basically $10 per month, if we're looking at the consumer side, is really a reasonable estimate for a month. That would be perhaps $40 $10 per month. And let's say if they go to Active SG Gym for senior citizens is $1.50, and the recommended frequency of exercise for seniors is 3 times a week. For strength training, it's at least once a week. So if we consider that $150 per gym session, 4 weeks in a month, that's $6 per month. But if we incorporate the cost of traveling to these gyms back and forth, let's say it's $1, very, very conservative estimate, 50 cents there, 50 cents back, that really puts our pricing strategy at a very competitive level compared to the current cost that people would have to pay.
Okay, thank you for your response. Next up, we have one from Mr. Joshua. So, Mr. Joshua would like to know what differentiate your gamification from all the other solutions that are in the market to encourage compliance and stickiness?
Well, thank you for the question. Well, really, the gamification that we're intending to incorporate is very, very simple and straightforward. So I think now most of the hit games, the in games, are more complicated than not. So that really is a barrier towards elderly taking up games. So why Pokemon Go was so easy? It was just swiping. It's just pushing thing up and down. And we realized that a lot of these movements, let's say translation, movement in one direction, X, Y, or Z, or rotation in one axis, X, Y, or Z, can actually be performed using fitness corner equipment. So that kind of makes it intuitive. The movement is intuitive to the movements, to the actions in the game. And that's really where we're targeting at the user friendliness of the games through simplicity, through them being simple.
Yep, thank you. So there's actually a similar question asked by our mentor, Kevin, as well. So has there been any in-depth study or survey done with OA patients with regards to the games you intend to feature? I mean, you mentioned that these patients actually have played them before. Would them actually be interested to play the same games now?
We believe so, because this is kind of a reminder of their youth. And I think one thing the elderly really struggle with mentally is that they wish to, go back to the times where they were more youthful. They perhaps had more mobility. And we envision that, the retro games would really provide that sort of throwback, in a sense, to their youthful days. Yeah.
Okay, hi, I'd like to chime in after what Tristan said. So actually there are studies done around the world based on gamification for elderly, because it's a sort of up and coming field. So what they found is that elderly prefer more intrinsic drive, so say familiarity with the game, what they played before, as well as other aspects of their life, such as social, whereas the general gamification, such as what we see in what we play usually, like such as badges and icons and points, are actually not the main drivers for why elderly will uptake this. So actually our motivations in designing a game actually fit quite well with what they found out in the different literature that's present. Yeah, thank you.
Thank you, Jules. Actually, next up, there's a question regarding the product rollout. So in this is from Dr. Mayang. So since they are, both consumer and medical products you have mentioned just now, what is the sequence of developing them, and why two products? Is there a synergy between them?
Right. So really the sequence is we're looking at a commercialization of our commercial product in the first quarter of 2023, medical device second quarter 2025. And the reason medical is definitely longer because of all the regulatory approval that we need to go through. And why we want to develop two products, consumer first before medical, is because we want to collect some form of data, because this is a really relatively new thing, new platform in the market. So we want to validate things like what we shared just now, a prospective cohort study, and what's the increase in the compliance, whether there's really an increase in the frequency of exercise as through our gamification platform. Yeah, so that's why we're kind of going at the consumer first before medical, so such that our consumer can also kind of inform the progress of our medical device commercialization. And why we didn't just want to go to medical alone was because we realized that it can be a great thing for consumers, like they can have fun playing games at the fitness corner, and we thought, well, why not? Yeah.
Okay, hope that answers your question, Dr. Mayang. So next up, we have one from Dr. Agatha. So will you include a fall detection feature in your brace to increase the safety of the exercise done without supervision? Because understanding that some of them might be elderly. Yeah.
Yeah, understand. Yes, perhaps in future development, but for now we're looking at more of developing it for proof of concept testing, where there will be on-site supervision, and that would address the safety.
Okay, thank you.
I think I can add on to that. So the great thing about using machine learning is that any kind of outlier in terms of EMG data or accelerometer data, let's say someone goes too fast or there's a sudden spasm in the muscle, it will be picked up by the sensors. So if there is a fall, then we could train the model to identify that. So first you start with an outlier detection, then classify the outlier. And so that would be an easy but good thing to incorporate. So we could do the same thing with things like weather, if it's too hot outside, recommend that you drink water. And so the apps are really great because they're easy to use and easy to update.
Awesome. Thanks for your response. Just a time check. You have roughly 2 minutes left, and for our steering committee members, feel free to ask any further questions. We can take one more. If not, for the team, any things you want to share, based on the discussion so far that you feel like you have left out? Yeah.
Yes, maybe if I could just add in terms of the motivation, one thing that we're actually thinking of doing is actually using personalized motivation. So kind of like how, Spotify provides personalized music recommendation, YouTube provides personalized video recommendations. We're actually thinking that for our app, we can use personalized rewards that would actually really, really motivate each individual, like say, for example, somebody prefers discounts off coffee rather than NTUC vouchers. So then we know to stop using NTUC vouchers as the rewards, but more of coffee discounts. And suppose somebody likes to play pinball more than Pong, then we can recommend pinball as a game more than Pong based on that whatever game they select when they choose to go to the fitness corners. Yeah, so we're really thinking of making it more innovative by using personalized motivation.
Yep. Okay. Thank you. And you have roughly 1 minute left. Any closing words? Anyone you want to thank? Yeah, your mentors. I don't know.
We would like to thank Mr. Wayne Wee for his very good supervision, and we would like to thank the organizers for this and everybody who support us in the process. Thank you to our judges for your support in the future, and we hope to see you with us.
Yep. If not, thank you so much for the fantastic presentation. Yep. So we now transit to the next team, and I will kindly invite you all off the stage as well.
Thank you, team.
Thank you. Good job.
Thank you.